Well, good morning, everybody, and welcome to today's webinar, Illinois Community Health Worker Policy Update, and a look at how you can get involved in this movement. I wish I could see all of your lovely faces, but such are the times we live in. I'm Margie Schaps. I'm the Executive Director of the Health and Medicine Policy Research Group, a policy research advocacy organization working on a variety of issues to improve health and decrease inequities in health and healthcare here in Illinois. I'm so glad to be hosting this along with so many of our partners. Central to the work of health and medicine has always been an effort to strengthen the health and public health workforce. And we have long recognized the value and contributions of community health workers and collaborated with many of you to advance certification, training, credentialing, and reimbursement of this vital workforce. We're so pleased to have gotten where we are today in Illinois, and it literally has taken a village or many villages, to be more accurate, to get us to where we are. So thank you to all of you partners who have helped move us to get to where we are in Illinois. We're pleased to present this webinar with our partners at the Sinai Urban Health Institute and our foundation partners, Community Memorial Foundation and Healthy Communities Foundation. The foresight of the boards, leadership, and staff of these two foundations has been critical to establishing the CHW workforce to advance health equity in the communities they serve. Several of these leaders are here with us today, and we owe you all a deep gratitude. A few housekeeping things before we begin the program. Live Spanish translation is available via the globe icon on your computer, and that's the interpretation icon in the menu. Go to interpretation, select Spanish audio, and then mute the original audio. Instructions on how to join the Spanish audio will be put in the chat in Spanish and in English. The webinar is being recorded, and all slides, handouts, and surveys mentioned today will be shared in the chat, as well as in a follow-up email that goes to all of the attendees. With regard to questions and answers, thank you for the many, many questions that were sent in on the original registration. All questions that we possibly can will be answered at the end of the presentation. Given the number of questions we received from the registration prompts, the presenters have all agreed to stay for an extra half hour after the event to continue answering questions. So please do stay with us if you're able to. If you're not, check out the recording when we send it out. So we will be recording that extra half hour. The chat and the Q&A function will be monitored during this entire webinar, so we will get to your questions as quickly as we can. Please feel free to put them in. Next slide, please. As we begin today, I hope you'll read this slide that acknowledges that the land we are all on today belong to Native nations, and their stories and their struggles should remain with us as we talk about community, belonging, and health. Next slide, please. We have a packed agenda filling this hour, including speakers on this slide from the Illinois Community Health Worker Association, the Sinai Urban Health Institute, Alivio Medical Center, Community Memorial and Healthy Communities Foundations, Health and Medicine, and the Cook County Department of Health. I'm so pleased to share this webinar with all of these amazing people and organizations. Next slide, please. So let's get to it. There are over 400 people registered for this webinar. This is just one data point that speaks to me and exhibits the exponential growth in interest and recognition of the importance of community health workers as central to our mission of creating healthier communities with a focus on health equity. COVID has certainly laid bare the inequities in health and healthcare and this disproportionate burden of disease and death on communities of color. It has shown a light on the value of trusted messengers, trusted community members as connectors to health information and services. These are community health workers. CHWs have been active in Illinois for decades, and our partners at Sinai Urban Health Institute have been studying the impact and importance of CHWs for many, many years. As we have learned more and seen more, the numbers of CHWs have grown enormously, as have the fields in which they work, from behavioral health to health system navigation, to asthma prevention and treatment, to maternal and child health, to housing insecurity and homelessness, to end-of-life care, and so many more. We are thrilled that the work and value of community health workers is being recognized in our state in significant ways that we'll learn about in just a moment. Let's take a look at the next slide. Okay, 3 years ago, inspired and supported by Community Memorial Foundation and Healthy Community Foundation leadership, staff, and board, Health and Medicine and the Sinai Urban Health Institute teamed up with 5 different types of community-based organizations in the western suburbs. You'll hear much more about this later, but I'm just teeing you up with a little bit. We undertook a 3-year pilot program, an innovative learning community of community health workers. I'll just tease you with this slide that looks at the end of the 2nd year of this 3-year pilot program. It's literally a snapshot showing you the impressive growth and impact that a CHW can have in their community with training and time spent working with community members. What this slide shows you is that in the first year of the pilot, 26% of the 954 referrals that were made were closed loop referrals. And what that means is that the referral actually resulted in the person accessing services. And that in the 2nd year of this program, the number of referrals made was nearly 2,600, and 71% of those were closed loop. And that number of new contacts increased almost tenfold over the course of those 2 years. That is remarkable growth and emblematic of what we're seeing happening across Illinois and across the country. We've just finished our 3rd year of this pilot, and we'll be out with a report summarizing another successful year within the next couple of months. Next slide, please. So let's talk about where we stand in Illinois through our newly passed legislation. And there's no one better to talk with me about this than Letitia Boughton Price, the co-executive director of the Illinois Community Health Worker Association, who helped guide the development of the legislation, and a longtime community health worker herself, a community health worker leader, advocate, and partner to us at Health and Medicine, and so many of you across this webinar and across the state of Illinois. So Letitia, welcome. Glad to be together to have this conversation.
Yes, thank you, Margie.
So Letitia, why don't you take us through first, give us a look at the background of the legislation. How did it come to be?
Well, this legislation came to be based on our relationship with people at UIC who had some previous interaction with the Legislative Black Caucus around, different areas of health. And we were brought in because in that conversation, Senator Maddie Hunter, Representative Lilly, and other members of the Legislative Black Caucus were very interested in community health workers and their role in dealing with the inequities and the lack of diversity and a lot of the health systems and just different systems across the state. So we worked with, UIC and others on piggybacking off of a 2014 piece of legislation that was passed under Governor Quinn that we really needed to get more traction on. So it wasn't the first time that we've had CHW legislation in Illinois. This was just going to be a more just a better version with the assistance and backing of the Legislative Black Caucus. Now, Illinois CHW Association is a membership organization representing over 400 members that include community health workers, allies, and stakeholders. So Letitia Boughton Price or Wandy Hernandez Gordon didn't do this by ourselves. We definitely stood on the guidance and direction of a lot of our membership and our board. So again, with the help of the Illinois Legislative Black Caucus, they took a strong interest in the work of community health workers and included this legislation, House Bill 158 and Senate Bill 336, in their bigger bill on health.
Thanks, Letitia. So can you tell us now, can we get into the meat of the legislation? Tell us what's in it, particularly in these three areas: training, certification, and reimbursement. Take them one at a time or however you want to approach this.
Yeah, so the legislation really talks about training, like a multi-tiered academic and community-based training opportunities. It also discusses a certification board to develop processes, requirements, so on and so forth, to certify community health workers as individuals, but also certifying training programs, which will also include a grandparenting process. And then it also covered reimbursement. So through Medicaid, through our state Medicaid office. So coverage for CHWs, the services that they provide, and then, of course, integrating them into managed care programs.
Mm-hmm. And can you tell us some about the core competencies and the requirements?
Yeah, thank you for that. So again, this bill is definitely building off of the 2014 legislation that identified some core competencies and skill sets. And we are definitely taking that into consideration when we think about a certification process for CHWs in Illinois. We like to focus on core competencies and skills as a basis of certification, and not necessarily claiming one process over another when it comes to CHW. So like our higher learning institutions, such as South Suburban or Malcolm X, that have a community health worker training program versus a community-based organization that is doing the work in the community who has a community training. We don't want to say that this higher learning education curriculum is better than this community-based curriculum or training. And so we figured out that what would be the common denominator is if everybody can meet a set of core competencies and skill set, and then that would be the basis to kind of determine, the skills and the qualities of a person who deems themselves as a community health worker. So this work around the core competencies and skills has been done through ILCHWA, through the National Association of Community Health Workers, through the American Public Health Association. There has been a national core consensus project, and that's how we settled on core competencies that we felt will work best here in Illinois. So we are definitely using that as a basis to start that process around thinking around when people call themselves community health workers, if an employer hires them, at least they'll know this will be something that they can count on this person walking into the door with a set of, core competencies and skills.
So some folks might not be familiar with the term grandfathering in. Can you explain that?
Oh, yes, yes, yes. So I know we've been talking about grandfathering, but I think I want to kind of keep it like gender neutral in this day and age. And we want to consider grandparenting. And what that means is um, this will take into account someone's experience versus um, a training that a training certificate that was issued by, a community-based organization or a higher learning institution. So this will take into consideration a person's experience, and then, the certification board, which will be housed within the Illinois Department of Public Health, um, and they will, that board is going to come up with the criteria of what certification will look like. And so, different boxes will be checked off. So this grandparenting process will allow folk who have been doing the work for decades to count their experience as a part of this certification process. I hope that clarifies.
That's great. I know there's so many more questions for you. Maybe you could talk for a minute or two about how people can get involved and the connection to ILCHWA and engagement of this audience and others.
Yeah, so the Illinois CHW Association is definitely doing this work and has been doing this work since the 1990s around curriculum work, even dating back to the curriculum that was going to get started at Daly College. So some of the people participants have participated in that process back in the 90s. So we are definitely continuing the work around workforce development, around certification and reimbursement, as well as, working with IDPH, the Illinois Department of Public Health, around this certification process. So you all can email the easiest way. I mean, we have a website, and you can definitely go to our website. But the easiest way is to email us at ILCHWA, ILCHWA 2018 at gmail.com, ILCHWA 2018 at gmail.com. Let us know your interests, and we will respond to you because there are plenty of opportunities to get involved. We have some upcoming trainings for community health workers around oral health, because we know sometimes people separate that from just general health, and we want to, kind of bridge the gap on that. But then we're also doing some stuff around, policy and advocacy work for community health workers. And we would love to get all of you involved as we represent the CHW voice in Illinois. So ILCHWA 2018 at gmail.com. Let us know, send us a shout out, and we will definitely find ways to get you involved in this much needed work. And we just want to continue to build on the momentum. And thank you, Margie, and for having me on this call and for working closely with us as we elevate and grow the CHW workforce here in Illinois.
Patricia, thank you so much. And I'm glad you're sticking around for the Q&A, because many people have questions for you. So
I'm
thank
here
you for that
yes.
introduction
Sure.
and in comprehensive sense of what is in this piece of legislation.
Thank
so
you.
I want to give you a moment, everybody, about what's up next. What's the process moving forward in Illinois? So the Department of Healthcare and Family Services, HFS, and I think we have some HFS representatives with us at this webinar today. They've taken comments from dozens of organizations. These comments were due at the end of last year, and they are in the process of putting together the comments from all of these organizations to influence how they develop the implementation plan for this piece of legislation. Unfortunately, in our state, as in many, the passage of legislation does not mean immediate implementation. It's the beginning of an important process. It's a very important milestone. We have to go through a period now of developing rules and regulations that will happen at the State Department level. And that's what many of us gave input on toward the end of the year. It's really impossible to tell just how long this will take, the rules and regulations development, before we actually implement the legislation. So the most optimistic view I can give you would say it'll take about a year, but I think it could take much longer. It just depends how fast the state is able to move on this. They do have so many other competing bills that they're developing rules and regulations for. And at the same time, the importance of this piece of legislation and the community health workforce, health worker workforce, is really, really important and high on the agenda for the state. So I encourage you to get involved through ILCHUA, as Letitia was just pointing out. Make sure to get on their mailing list, get on the mailing list of Health and Medicine. We'll send updates to you regularly so you'll know ways to get engaged and what the status is of implementing this legislation. We will tell you everything as we learn about it. So now it's my great pleasure to introduce my colleague at Health and Medicine, Angela Eastland, who's a workforce policy analyst at Health and Medicine and the leader of our community health worker efforts. And Angela will take over for the next piece of the program. Welcome, Angela.
Thanks, Margie and Letitia, for that overview of the legislation. And I'm excited to dig into the Q&A section. I do want to note that we will be sticking around for an extra half hour or so, just based on the amount of questions that we got from the registration and in the Q&A so far. So if you're not able to stick around, we'll of course have the recording and slides for you after this. But for this moment, I want to invite Esther Corpus to unmute herself and start her video, because we wanted to share some local opportunities. Since the bill is still in the implementation process, we wanted to share some local and regional opportunities that are more immediately accessible. So Esther Corpus is the CEO of Alivio Medical Center, a federally qualified health center. And I'm going to invite her to share a little bit about their experience with community health workers as part of their care teams and some alternative funding mechanisms that they've utilized. So welcome, Esther.
Thank you, Angela, and thank you for all the participants in today's call. I have to do a shout out to my Alivio community health workers. I've seen many of them and all community health workers that are participating in today's discussion. So just to give you a little background, Alivio has been in existence for 33 years. And as part of our practice, when we opened our doors, community health workers have been part of our practice. And I think that's really important to note, because while it's at the forefront today, I think we have really good data on the important impact that community health workers have provided over decades. And this model was modeled after, practices in other Latin American countries, and we have sort of modeled ourselves on that. What I would like to say, number one, is the sustainability of community health workers over the years, because we have had our ups and downs with community health workers where funding has been an issue. And so this EPIC legislation really provides sustainability for community health workers, because they do have a place in everyone's practice and in other environments, like with payers. We at Alivio have used them, most recently with COVID. And they have been, educators, but also, proven trusted messengers around, vaccine efficacy and helping us with testing and education in community environments, such as, a laundromat, going into the community where, rather than waiting for people to come to us, they went to them. And, and during these trying times, I have to say, they were fearless and very committed to reaching out to the community. We have used them over the years, and diabetes prevention. And there is funding for diabetes prevention on a national level. So you do have to be enrolled in Medicare. I don't want to go into too much detail, but those of us who are caregivers and have a Medicare or a Medicaid provider number can enroll. There are steps that you have to take, and our community health workers will get reimbursed, or the organization will get reimbursed for the services that they provide. And so I think that that's very important, especially in minority communities. We know that diabetes is one of those illnesses that affects the Black and Brown community at greater proportions than other communities. And when you can do that, there is a reduction in admissions to the hospital, to, getting them back into care after an ER visit, and improved outcomes. And I would say, community health workers are just very important to just chronic disease management overall. So I guess, the most important thing is really, the sustainability of community health workers. And I think that, having this discussion today and talking about the funding that's coming down the pipeline. Also, I think, with the awareness of the value that community health workers bring, funders like the Community Memorial Foundation and others have invested in us, providing education and making sure that they will continue to be part of our practice. And so if you're not quite ready for, diabetes prevention management, or as we wait for this bill to unroll, there are other ways, I think that funders are very open to supporting, community health workers, because we now have a track record of the value that they bring to our practices and to the community.
Great, thank you. And I'm seeing already some questions about the chat about diabetes prevention reimbursement. And so I'm sure we'll have an opportunity to expand a little bit on that in the Q&A section, but also maybe we can connect folks with you after this webinar to explore that opportunity, especially if folks are connected to organizations that are already enrolled in Medicare. So thank you, Esther. And for now, I want to invite Kim J, who is a senior CHW at SUHI, Sinai Urban Health Institute. And she is also a board member of the National Community Health Worker Association, as well as a board member of the Illinois CHW Association. So she wears many hats in this realm, but I think she's perfectly positioned to share with us a little bit about where career pathways have existed, or what career pathways have existed for community health workers. This isn't just a singular role, and where you kind of see career pathways headed in the future or lately for community health workers. So welcome, Kim.
Thank you, Angela, and thank you to all the previous panelists that have been on. As Angela said, my name is Kim J. I am a training manager and senior community health worker with Sinai Urban Health Institute, and have been a part of some amazing initiatives that I have CHWs at the focus. To give you a little background, I've been with Sinai Urban Health Institute for almost 10 years now, but prior to my coming, they have been the pioneers for the CHW model. This model was first implemented with pediatric asthma within the healthcare system, but there was still a disconnect, and that disconnect was something that was happening in the home realm. So community health workers were dispatched to the home to see in real time what was going on with patients and be able to connect them with care and improve their quality of life. With that model and them honing that particular CHW model for over 20 years now, it's become like the blueprint for various organizations and many people to pattern their programs after that model. And I want to speak to one of the initiatives, not only what we're doing with HMPRG, but the work we're doing in a larger state with the state of Illinois. I will start out saying that Sinai, in partnership with um, the Chicago Cook Workforce Partnership, Department of Public Health, University of Illinois at Chicago, Newark, and Malcolm X College, were in partnership to onboard over 600 contact tracers to do community members to do contact tracing work. These community members came from 31 um, community-based organizations in areas where there was a, a disadvantage in financial security and also um, disinvestment in these communities. So these community members were hired to do some very important work, and some of them had no experience, some of them had a bit of experience, but we were able to gather this community of folks, get them onboarded and acclimated and trained to do this amazing work. And as a result, we know that that was the intro into that community health work or that public health arena. And our job, still as it goes on, is to reinforce and add on that professional development under those core skills competencies, those C3 competencies that Letitia already spoke to, that would allow these community members to be prepared to do work after this particular initiative. It is so powerful because this initiative was intentional to address a couple of facets. You know, how do we empower these communities to be advocates for themselves, to have financial stability, and get an intro to a field that's absolutely valuable and change the quality of life for the areas that they live, work, and thrive in. So, with that, it has been indeed an honor to watch this transition and people be included in this endeavor. And their interest has been sparked in community health by this process. And as a result, many of them are branching out to different arenas of public health because of this exposure. And that is like the inroad to the community health work or public health. Sometimes you have to come in through a different door to be open to the table that's spread as far as opportunities in community and how you can better serve your community through the community health work um, model and the career pathway.
Thank you, Kim. And it's really exciting to hear that there's so many folks in the Chicagoland area that are primed to, enter into the community health worker workforce or the public health workforce. I'm always interested at how Sinai Urban Health Institute models levels of community health worker roles. So you are a senior CHW at Sinai Urban Health Institute. So can you talk a little bit about how there's even workforce development within the career of being a community health worker?
Absolutely. Previous speakers have spoken about experience and how the experience can have you grandparented into being certified. That same kind of experience does lean toward how you're elevated in the community health worker a career pathway. So somebody who is new to the workforce may start at a CHW1, but as you learn more skills and you have more exposure, those can go up to a 1, 2, senior CHW, and then different uh, veins of community health work. You may want to go into advocacy more as a refined process. You may want to go into the epidemiology component of it, which is the research of the numbers and the data that's collected. Uh, Public health is so vast and so inviting, depending on what your area of focus could be. And I am very proud of even how Sinai Health System, Sinai Chicago, is incorporating this process of entering a different way to getting exposed to the community health worker field and that model. And it's called Healthcare Forward Chicago, which is an initiative that Sinai Chicago has started that would allow regular community members, that's for lack of a better phrase, who've never had any experience in community health or public health to have those entry level positions into the hospital that then they can learn more about the community health worker role, and then seek positions within the healthcare system that would match their area of interest. So the leveling up comes from being just new to the field, and the more experience you have levels you up as far as career pathways. And that's one of the things we need to be cognizant of for community health workers, because we don't want to see them as a one trick pony or just a one avenue. They are multifaceted in their capabilities and their knowledge. And I don't want people to get stuck on them having to have a bachelor's or a degree to do this work. This work is based on the foundational investment of community members to their community to see it thrive and prosper. So, on that same vein, is how we build and introduce community members to community health. To say your innate passion already is one key ingredient to be an effective and powerful community health worker.
Can I just add one thing that I probably should have mentioned? And thank you, Kim. I mean, that's amazing what you just shared with us. I think the other cultural competency and being able to relate to the communities that we serve, being not just bilingual, but understanding, the cultural needs of the populations that we're serving is very important. And I know that's something that's very important to Alivio. We serve a very large immigrant, undocumented community, and that trust is really important. And understanding the needs of the communities that we serve.
Definitely. And thank you. Yeah. Thank you for bringing up that point. That's definitely core to the community health worker role. And so I appreciate that. Well, now I want to hop over to our public and private partnership section. So we have some folks on the line from Cook County Department of Public Health, Darcy Muller. I want to invite her to unmute and share her video. And she'll be sharing a little bit about some exciting new initiatives. The community health worker role just keeps expanding in the state of Illinois, and health and medicine, we're really excited to be a part of this initiative, but I'll hand the mic over to Darcy to share a little bit.
Thanks, Angela. Good morning, everyone. So I'm Dr. Darcy Muller. I'm the COVID-19 Health Equity Medical Director at the Cook County Department of Public Health, CCDPH. I always like to clarify for anyone who's not as familiar with the different public health departments that we are the state certified health department for all of Cook County, exclusive of Chicago, Evanston, Oak Park, Skokie, and Stickney Township. So we serve about 2.5 million people in 125 different municipalities. So I'm happy to have the opportunity today to just very briefly share some of the work that CCDPH is doing in the CHW arena. We are currently in the planning stages of a community health worker initiative that's being funded through federal dollars that were primarily awarded for COVID-19 recovery efforts. So lots of overlap here with what I'm hearing from Kim J about elevating contact tracers. We're hoping to do some of that same, furthering of the work. And we currently have funding secured through the end of 2026. Our initiative has 2 phases that will run concurrently. An internal phase in which we're hiring a team of 9 community health workers who will focus on coordination of social resources and health education, primarily COVID-19 health education, but also others for suburban Cook residents. And an external phase, which I think will be of interest to many of you. CCDPH is committed to supporting CBOs like many of yours and working with CHWs to reach priority populations in suburban Cook. And we're planning to announce a funding opportunity for organizations who are either already actively using CHWs or who would like to employ 1 or more CHWs to work with their communities. We hope to announce an RFP by this spring, if not earlier, so keep an eye out for that. The other important piece of this initiative is to establish the Suburban Cook County CHW Learning Collaborative. That would be a place for organizations employing CHWs in suburban Cook to share information and resources and collaborate on trainings. We're working with HMPRG and SUI and others to leverage the experience that they have, especially with that CHW Learning Collaborative that was on the west side. And we're developing public-private partnerships with the health foundations who funded this work on the west side and looking to expand. So I think that's a perfect segue. I think you're going to be hearing next from the Healthy Communities Foundation and Community Memorial Foundation. And I'll be open for questions later on. Thanks.
Thanks, Darcy. Yeah, I'm really excited about this initiative, and I'm sure folks will have many questions for you as well. All right, so let's bring Nan Silva and Nora Garcia from Healthy Communities Foundation and Community Memorial Foundation onto the line. Hi,
Great.
Nora.
Hi, how's it going? Hi, everyone. So I'm going to wait for Nan to hop on. Perfect. So I'm Nora Garcia.
Hello.
Hi. Should we go ahead and get started, Nan?
Go for it.
Perfect.
Absolutely.
Great.
Please.
So I'm Nora Garcia. I'm the program director at the Healthy Communities Foundation. And together with Nan Silva over at the Community Memorial Foundation in the western suburbs of Cook County, both foundations have recently completed a 3-year pilot phase of the CHW initiative in collaboration with Health and Medicine Policy Group, as well as Sinai Urban Health Institute, and have actually begun a subsequent 3-year initiative phase. So we are just embarking on that next 3-year phase that we're so excited about. 5 organizations, each with a very different focus and approach, are funded through this initiative. They include Alivio Medical Center, Beds Care Plus, HAS, Mujeres Latinas en Acción, and Aging Care Connections. Together, these 5 community-based organizations have been part of a really exciting learning collaborative since the inception of this pilot in 2019. And so we think that the stars have aligned, and with all the momentum created in the last year around CHWs, we plan to grow the learning collaborative component of our initiative to include additional community-based organizations to really create a West Suburban think tank, for lack of a better word. So we really want to expand. We think that what's been most beneficial of this pilot, in addition to meeting the needs of residents in suburban Cook, is really this learning community that has been built with very different types of organizations that are implementing and utilizing this model. So in addition to that, we also hope to expand this pilot potentially into DuPage County as well. And so with that, I'll go ahead and pass it to Nan.
Thank you, Nora. And it's always a pleasure working in partnership with Healthy Communities Foundation. I'm Nan Silva. I am Program Director at Community Memorial Foundation. And we're very excited at, as you have heard, the progress that we have made over the last 3 years of our pilot in the western suburbs, and looking forward to jump on this momentum to be able to see where this particular stage will take us in our community health worker growth. Now, we know that participants, all of you are from the whole of the Chicago metro area. So even though our particular work is for the western suburbs, we want to capture everyone's interest in creating a regional CHW learning collaboratives across the state. Toward that end, we will be sending all of you a follow-up survey to gauge your current and/or planned CHW work. The idea is to build upon this statewide CHW policy momentum and create an interactive ecosystem wherein we can continually learn from one another about how to strengthen our communal public health infrastructure through community health workers. An ecosystem that includes community-based organizations, health departments, policy and research entities, state and national community health worker associations, and private health foundations. The learning collaborative topics and meeting dates and times will all be determined by the locally based learning collaborative members themselves from whatever region they happen to be located in. Now, in terms of the specifics of this survey, I'm going to go ahead and turn that over to Angela to be able to go over those details.
Thanks, Dan and Nora. So yes, we're really excited about the opportunity to expand the learning collaborative model that brings community health workers together to regions across the state. And so one way that we're hoping to gather that information is via the surveys that Nan mentioned. So in the handout that was just dropped in the chat, we have a couple links to, we have many resources on that handout, but there are a couple links. So there's a link in Spanish and English for a feedback survey and an opportunity to have your email shared as a networking, for networking purposes with those that are attending this webinar. But also I want to point attention to the second survey, which is to gather your interest in having a regional learning collaborative in your area or joining the one that we're forming here in suburban Cook County, or in the Chicagoland area. So please fill those out. And I think the direct links are being dropped in the chat as well. But for now, as you fill those out, we want to shift over to Margie. I'll hand the mic back over to you to kind of wrap us up. And then hopefully most folks can stick around for the Q&A section. So Margie, back over to you.
Okay. All set? Great. Thank you. And thanks for those wonderful presentations, everybody. So just a couple things before we start the Q&A. We are very interested in your interest in networking opportunities and in connecting with you. So remember to connect with ILCHWA or Health and Medicine if you want to continue this work. A teaser for you that our year three of our pilot program did just end in December. Our report will be out shortly and we will share it with you and hope that you will find this as useful in your planning as we have found it for planning our next 3 years. Reminder to everybody that Spanish and English recordings are being made. The slides and other resources will be shared with you in a follow-up email to everybody. I so appreciate you participating in this program, being here with us today. Please complete the surveys. That's how we'll know about your interest and we'll make sure to keep you on our mailing lists. The first is for feedback, granting us permission to share your email to other attendees, and the other is to gather insight on you and your organization's interest in joining or building a CHW collaborative in your region. So thank you again to all of our speakers and to everybody for joining us. Let's move into Q&A.
Okay, thanks, Margie. So I think we're gonna have Shannon Sweetnam, our communications guru, hop on and share some of the questions that have been both submitted in the pre-registration links as well as in the chat and Q&A today. But I think if Shannon's not online just yet,
Hi. No,
there she is.
I'm here. So some of the questions that were posed in the today, our first question of the day was directed to Letitia, and the question is, does it mean that there has been certification processes for CHWs already? And would only certified CHWs work be reimbursed by Illinois Medicaid plans, private insurance, and Medicare?
Okay, I can't take myself off. I can't start my video.
Letitia, we can hear you if you want to respond.
I don't know, I just need, so there are reimbursement opportunities for community health workers through a lot of foundational support, grant support, some, managed care organizations, some systems that have multiple layers of funding streams are able to reimburse for community health workers. This is part of this process of, because this bill allowed for the first time in the state of Illinois, officially, Medicaid to look into reimbursement services for the work of community health workers. This does not mean that we don't want, continued support from, existing funders like our foundations, like, our national and local supporters, grant supporters, because we do know that all of the CHW services that are provided may not come up under this reimbursable umbrella or the state plan amendment at this particular moment. So that's why this work is not over. We still have lots of work to do to ensure that services for the community health workers, all of the services that they provide get reimbursed, but most importantly, that the CHWs who, that the workforce just advances in the state of Illinois. So we, unfortunately, for organizations that don't have direct access to a Medicaid funding source, this third party, right? You have to partner with a group that has those Medicaid billing capabilities already in existence. So we're working with the Medicaid office to figure out ways to kind of make that system a little bit more user-friendly and try to figure out how, people can get access to the reimbursement strategy. But as Margie mentioned earlier, this is not a sprint. This is a journey. But rest assured, with your support of this work, we will try to get, things in place so that it won't take 5 and 10 years, because the work of community health workers has been done in Illinois for decades. Plenty of institutions, systems have benefited from the work of community health workers. There's enough evidence to support it. Now we just gotta, dot the I's, cross the T's. And with all of us working together, I think we can get this done in a nice, smooth way to ensure that the CHWs are paid, living wages, are, respected on a statewide level, are recognized for the work that they do, and people will be dying to just be a part of the CHW workforce. So thank you.
Can I just add just a couple things? Thank you, Kim. I know that the bill, the Illinois bill, does ask HFS to also work with the payers, so that I know that not everybody, can access, or can charge for services. And so as Kim said, collaborating with other community-based organizations that may not have a Medicaid or Medicare number, we're happy to work. I think that this is really important. But I think the bill also is requesting that we work with HFS on identifying those services that should be reimbursable. And so, as Kim said, many of us have been working on this for years. And so we need to continue to work together to identify those high need areas, because the sustainability, again, is so important. The evidence is there. There is, for those of us who are Medicare providers, there is reimbursement for diabetes prevention, and it is sort of a program where it is, based on the patients themselves, very involved in their care and seeing the progress of outcomes, positive outcomes, and being enrolled in a diabetes prevention program. And so it's sort of a tiered program. I'm happy to, I will send, and I think you may have it, but I will send it to Margie so that she can share it with the group on how you can enroll in the diabetes prevention program.
If I may add, so HFS, and I think Margie mentioned this earlier, HFS did ask for comments to be submitted. I think it was the end of December, right? To try to figure out how this system is going to work. What types of services will they need to expect to reimburse for the work of community health workers? So I am very happy in this progress and the commitment that HFS has, because it's a win-win situation for everybody, right? Everybody wants communities and people to be well, to stay out of the emergency room, to reduce the cost to the system. And so it's important that we just continue to stay involved. HFS has been participating in the Illinois CHW Association certification and reimbursement meetings. And that's where we are able to give them additional feedback on this progress, right? Because they want to hear from us. They want to know what is going to work for Illinois and how it's going to mash and mesh with their rules, regs, and processes and procedures, right? So the more that we have these types of conversations, allowing for people to provide their inputs and their feedback, the better we will be in the state of Illinois. And remember, it is as much as we live in this microwavable age, things are going to take time, but it doesn't need to take that much time. We just need to continue to have these types of dialogues and these types of opportunities so that we can help and provide input to these systems that are making these decisions.
Yeah, and I will add, because I agree, HFS has been wonderful. This is a great bill that passed, but let's not forget that we have a group of individuals, a large group of individuals that are unfunded. They do not qualify for Medicaid. And I'm speaking of the immigrant undocumented community that we continue to serve. And so, Healthy Illinois, which is part of Alivio, has, passed a bill to expand Medicaid to undocumented seniors. And we're going back this year to hopefully address everyone, because we feel very passionately about everyone should have access to healthcare. And that would also enable the work that the community health workers have been doing with this very hard to reach population. And so I just have to state that, is, there's a group of individuals that are not covered by this legislation. And that's why the other funders, like all of our private grantors are very important in, covering those that are not covered by any of the legislation that was passed.
Thanks, Esther and Letitia. So many good points made there. I want to move us on to another question since we have so many. Shannon, what would you like us to cover next?
There were quite a few questions related to training, accessing certification, whether there are stipends for training, the various levels of training, and how this would impact staff shortages. So I thought I would just pull those all into one question that some of our panelists could answer and just cover these issues of training and certification, and whether they would be available in different languages. That was a very big point as well.
Okay, great. Who wants to tackle that first? Maybe Kim or Letitia again?
So different organizations, community-based organizations, we have our higher learning institutions like South Suburban College and Malcolm X College. There is, oh God, the name is escaping me right now, but down in Southern Illinois, SIU Med has a training program. The Illinois Public Health Association is doing pandemic health worker training. So there are trainings that are happening. Unfortunately, I am unaware of any free, I think Suhi has something out, I'll let Kim speak to that, of free trainings, right? But in these institutions, they may have opportunities for like financial aid and, just other in-house opportunities for community health workers to get paid, to get trained as a CHW. So just to be clear, in Illinois, we do not have a certification process for community health workers. We don't have one. It does not exist. The only thing that exists is training programs that have been certified by the Board of Education, so that our community colleges can crank out certificate programs for community health workers, right? So that is the only thing that we have right now in process. So different community-based organizations are cranking out their own community health workers, like University of Chicago is doing some stuff with the help of SUHE. So SUHE right now is doing a lot of training across the city and in different counties. So I'll stop there and let Kim talk a little bit more about.
Thank you, Letitia. What I want to say that SUHE's training, unfortunately, is not free. However, we, in partnership with various organizations who have grant funding, we are able to train cohorts of different community members or CHWs. What I will say, Malcolm X College has a lot of amazing opportunities for training to get community members or people who are interested into the CHW model, and even under different titles that community health work can fall under. So what I would encourage those who are interested, who've never experienced community health or want to further their knowledge, to seek some of those opportunities. And even some community-based organizations could have some opportunities for training. It is really important that that foundational training be given. If it doesn't fall under that C3 core competencies, those skill sets that we deem necessary for somebody to be an effective CHW won't be there. And you want definitely to have that. But as Letitia said, there is no certification process currently in the state of Illinois. So you won't be like, oh, I'm an official certified CHW, but there are certificate programs that validates your training experience like we have. If you complete SUHE's 40-hour core skills training, you will receive a certificate. And those who receive a certificate can leverage that certificate for college credit at Malcolm X to enroll in their community health worker program. So I hope that answers the question.
Well, folks, we've reached 10 o'clock so quickly, and I want to thank all of our panelists. I want to thank all of you in the audience who have joined this discussion. This has really been so informative, I think, to everybody. We will officially end the program, but please, if you're able, stick around for the next half hour. We will take more questions. There's lots of them that Shannon has queued up. We'd be happy to answer as many as we can get to in a half hour. But officially, the program is completed. Thank you again to all of our partners, to our foundation partners, to Sinai Urban Health Institute, and all of you for joining us. Have a wonderful day.
Thanks, Margie. All right, let's dig back into some more questions. What should we tackle next, Shannon?
Okay, before we go back into reimbursement and advocacy, I have one additional question here about how CHWs will interact with the community behavioral health system. I don't know if anyone has any thoughts on that topic.
Looks like Letitia's nodding her head.
This topic is really near and dear to my heart. As a CHW, career pathway for me was social work, and I'm working on my clinical license in social work, and I'm looking to do some therapy work. So behavioral health and mental health is like very important, and I think it just really depends on the organizations, right? Because organizations like Thresholds, who, work with people who are living with mental illness and other challenges. They have peers that they, train to kind of work directly with that population. So I think it just really depends on that organization and the population that they're serving, and ensuring that, the right training goes forth to address the needs of their community. So one thing that was looked at, because in the 2014 legislation, we had those core competencies and skills. After that, ILCHWA, along with UIC Ocean, the Department of Public Health, the Public Health Association, did some roundtable discussions across the state and in the city of Chicago to figure out if, things were still relevant, right? And behavioral health, the opioid increased usage, those things kind of bubbled up as additional things that we need to focus on. So we are taking that into consideration. And I wish we could talk more about, when we say the health of a person, we don't separate the mental health from the physical health, from the oral health. Like, everything is inclusive. And I'd be glad when we get to a place where, when we talk about health, we're talking about the health and well-being of an individual. So we are definitely, will be advocating that, things like mental health, substance use, oral health, all of those opportunities are made available for community health workers to pursue, to kind of, help our communities to be holistically well.
And I think that leads right into the conversation we had with you, Kim, about, there's the core foundational skills that we recommend for all community health workers, and that will be part of the voluntary certification process. But sounds like a specialization, essentially, one of those pathways that you mentioned.
Absolutely. So once people are introduced to the community health worker, career path, it opens the door to a lot of other opportunities that are available, and it can be vast. And what I do like is how you can put a community health worker in any setting, and they become an extension of what that organization is or that discipline is. So with behavioral health within Sinai Chicago, our social workers are partnering with our community health workers to be an extension to that patient population, to connect to additional social services when they can't do all of those things themselves. The thing about it is to make sure they are effectively trained and mentored and supervised, to make sure that things are cohesive and they can be that addition and that resource to this patient or this client. It is, we don't want to any discipline to think of a community health worker as trying to step over their boundaries. We want them to think of it as the extension of what they already have established, because we have the time to connect and explain, be culturally competent. Health literacy plays a part, and be able to do that and do that effectively. So career pathways can migrate to any component of community health. It just means piquing the interest and know that it is available for you to do it, and there is an opportunity. And as Letitia said, you come in through community health work one way, and then you look, oh, I think I want to try this path. And I've always been very just intrigued about the diversity of the role, and I see people that I've watched in this field and have been just totally inspired by them. And Letitia is one of those people that have shown me, when I entered into community health work, what it could turn into for you if your heart and your energy and your spirit is there.
Darcy, it looks like you want to add. Yeah.
Yeah, I just wanted to add something and Letitia and Kim, I just want to second both of what you're saying, and I really appreciate your perspectives. I think this like sort of specialization idea is really interesting, because I think people can take a special interest in certain areas, but also something that, Kim, that you elevated that I wanted to also make sure everybody kind of realized was the role of the community health worker as a connector of resources. So I know that a big focus of the internal community health workers that we'll be hiring will be resource coordination. So identifying what needs do you have, and often they could be mental health or behavioral health needs, and connecting them to places like NAMI, right? To places that can give them really what they need. So when the community health worker doesn't have to have all of the expertise and the knowledge, they can be the connector.
Exactly. Okay, this is great. Let's keep it going. Shannon, what else do you have for us?
I have a question for someone who is representing all 708 community mental health boards. What can we do to advocate for these bills? Are there committee hearings or do you want testimony?
Great question. So the legislation that we've mentioned so far has already been passed. So that journey is done. Now we're in the implementation phase. So everything that Letitia mentioned about getting involved in ILCHWA's various committees, being an advocate or an ally organization, there's so many ways to get involved. And it sounds like your expertise is in the mental health, behavioral health space. So we'd love to have you join. I'm part of one of the ILCHWA communities. So please join us. Please bring your voice and your expertise, especially around Medicaid billing, things like that. We'd love to have you. So I think we'll add in Letitia's email again to the chat. And of course, you're welcome to email us. We'll send a lot of follow-up emails with ways to connect.
I have a couple of more advocacy questions, which are pretty interesting. One is just a question of how the broader network of CHWs and their voices be considered or included in the conversation. And I'll just add a second question here for time. How another person would like to know how they can propose developing something similar in their state. How to get it started.
Yeah, Letitia, do you want to take this?
Can you repeat the first part, Shannon? I'm sorry.
Oh yeah, of course. Repeating the first part is how the broader network of CHWs and their voices be considered or included in the conversation.
Yes, so the Illinois CHW Association in the past, as the Chicago Community Health Workers Local Network, hosted focus groups and just gatherings to allow for opportunity to get the CHW voice, allies, and supporters. The work groups that we host on a monthly basis is another opportunity to gather the voice of community health workers along with allies and supporters, so that we are going into these spaces and places, representing that voice to ensure that we are speaking not what Letitia and Wandy wants personally. We are the face, and behind us and who's uplifting us is our membership, right? So we have learned over the years, because we've been doing this work since the 90s, over the years, what CHWs would like to see around the professionalism of their work and their workforce, what they don't want to see. We have learned a lot about, the reimbursement. We've learned a lot about, being inclusive and ensuring that, everyone has the access and can get recognized and compensated for the work that they do. So the best way, again, is to reach out to ILCHWA at the email ilchwa2018@gmail.com. We can reach back out to you. We will be doing an even better job of working through our membership, especially now since, CHW is like it's hot right now. It's hot to talk about CHW. It's hot to be a CHW. That's like the hot thing right now. And so we want to, just capitalize on that momentum And so the more voices, you know, that's saying the squeaky wheel gets the oil, the more people that we have talking the same thing, because the person that made that comment, you probably at a space and a place that ILTRA has not had access to, right? So you would be the representative speaking on elevating the CHW voice in that particular space and place. So we will definitely, we welcome you to join us. We're still grassroots organization with the help of some of the foundations that are on the call. We are ready to position ILTRA and take it to that next level. So it's people like you that will help us get there. So we are definitely mission driven around elevating the CHW work force as well as the voice in the state of Illinois and beyond. So how do you get started, right? So email us and we'll give you more information, because we are the grandparent to the godparent, I should say, godparent to CHW group that was started out of Enlace. So we definitely have the experience of helping people formulate a CHW group within their respective areas. So we represent the state as a whole, but would love to have, you know, be the godparents to other CHW groups with a focus of elevating the CHWs and the workforce in the state of Illinois. I hope that helps. But if it doesn't, I'm available. Email me, hit me up. Like, this is a passion of ours. And we've been doing this work for a very long time, and we would love to see the continued growth and elevation of community health workers in Illinois. So just help us get there.
Exactly. It's a collaborative effort. And I just want to elevate too, that there is a National Community Health Worker Association as well that ILTRA is a part of and involved in various roles within that. So that's another opportunity to just even expand our Illinois community health worker voice as well. So please consider joining that as well as a member. Okay, Shannon.
Hi,
what else?
Angela, just a quick
Yeah.
question. There's a lot of text in Spanish. Do we have anyone that can address some of the
Sure.
questions? I don't know if the interpreter is still on the call.
We do have the interpreter on the call, but we do have someone that is on our panelist group that is adding questions to Shannon's list, but feel free to elevate one right now. Go for it.
Well, there's several, so I haven't read through all of them. I just want to be sensitive to, you know, give the bilingual, the Spanish speaking community.
Definitely.
Yeah. So.
Definitely. Thank you for noting that. Let's try to get one of those. Shannon, do you have one?
I think I have one quick question, and then to answer, and then I think maybe Jackie could hop on and propose some of those questions in Spanish that might be a little bit quicker. Letitia just answered a lot of questions that were in the chat. There was one question that hopefully, I don't think you've answered yet. Is there a central depository where all training programs could be listed, all certifications listed? Does that already exist?
There is no central depository, but that is what we're working on with our friends at UIC Ocean. There's been a curriculum group that has also been meeting. So a group of existing CHW trainers and educators. So, you know, we have been meeting around, you know, kind of like a curriculum, but then also talking about this particular thing. So that is something that we're working on, and we will pose this back to Angela Ellison over at the UIC Ocean, who's kind of the lead of that curriculum group there, and ILTRA is participating in that. But we can put that information out there and see if we can get something up on ILTRA's website. So thank you for that.
Mm-hmm. We have a a comment that came in Spanish. There's someone who is concerned the whole process will cut down on opportunities for many of our mothers who are currently or want to be health promoters, since many of them just want to be volunteers. From her own experience being a mother, she received training and certification as a CHW. Being a health promoter is not something that's been studied. She wants to be sure this is not going to affect opportunities of mothers who want to volunteer or get a part-time job without going through a lot of bureaucracy. So I don't know if anyone has a comment.
That kind of speaks to what Esther was talking about earlier. And so in the legislation, it does specifically state that whatever we come up with, that whatever new thing that we come up with does not hurt or hinder existing opportunities. And ILCHWA is definitely advocating that, because in our research, we have learned that there is hesitancy around the professionalism of the workforce, just for that particular reason, that people will be, I don't want to say eliminated or overlooked, but they will not have the same access. And so we are sensitive to that, and we are 100% committed to ensuring that anybody that wants to access CHW work will have that opportunity. So whatever it takes, we are trying to ensure that people like this person who was talking about the mothers that are promotoras, like we are working on those opportunities to ensure that if they want to work as a non-certified CHW because they have the training, then that job should not be eliminated just because they're not a certified CHW, right? And so that's why we are hoping and still counting on, grant support, foundational support, because Medicaid is just not going to cover 100% the needs and the employees that call themselves community health workers. And we understand that, right? And so we, again, are committed, and we welcome you to hold us accountable to that, right? Join us to ensure that when we are at these spaces and places, that we are definitely, talking about things that will not hurt or hinder existing opportunities. So please, thank you for that. We don't take that lightly, and we are 100% committed. That's why we, are including a grandparenting process, because people with experience, they can count all of that experience and be a state certified CHW, right? So those types of things help in that process.
Thank you. Yeah, that was a really important topic to cover. So I appreciate that comment.
We have another question that has come in on collaboratives with CHWs. Someone is asking, where are they? What communities are they in? How to get connected to these collaboratives?
Great. So there are many levels of learning collaboratives. So we have started one in the western suburbs that Nan and Nora mentioned earlier, of the western suburbs of Chicago, excuse me, and are looking to expand that to broader Cook County through the initiative that Cook County Department of Public Health is leading. But we recognize that this model is fantastic, and we recognize that the CHW role is collaborative just by nature. So we're hoping to expand and kind of spark interest in that across the state. That's why we're doing the surveys that we're sending out to you. But also there are national community health worker learning collaboratives that are being started by the National Community Health Worker Association. So that's just another opportunity to engage with folks across the nation that are also engaged in similar types of work and are interested in different topics that you might be as well. So thanks, Kim, for dropping the National Association website in the chat, and I'll let you, since you're more connected to that work, I'll let you.
Yeah, I am a board member with the National CHW Association as well. And I do want to uplift that there are national learning collaboratives across the state that you are welcome to join free of charge. And this is a model that we want to broaden from the western suburbs, from the pilot we've done so far across the state and broader, because it's important that that collaborative network is there, because again, where there's numbers, there's strength, there's unity in those numbers, and you're able to learn and glean from one another instead of reinventing the wheel all over again. So there's an opportunity to join one of these collaboratives and broaden your connections. Please feel free to take advantage, and also be prepared to be a part of the ones that we will start to implement based on your feedback in the coming future.
I noticed quite a few people are putting in, make sure to check the chat, because a lot of people are putting these resources in the chat right now. Someone else commented that we could possibly elevate this and work globally with the United Nations, have the world public health professionals be identified as higher level CHWs. So there's some expansive thinking here in the questions. I think it might be time to move on. There are a lot of very specific questions about reimbursement and funding. We can just go through these because they are very specific. One question is, what is the reimbursement rate per individual or group, and what services are covered?
I can kick it off and anyone else can hop on to add their thoughts, but right now there is no rate set because the Health and Family Services Department is still in the process of exploring the options that Illinois has, looking at other states that are a little bit further ahead of us in this pathway for reimbursing community health workers. So there is no current rate set yet, is the short answer, but we're looking for input, and I'm sure the department would, and maybe Margie, do you want to add? Yeah,
I was just going to add that some states use there's a fee for service rate that is used for reimbursement through Medicaid, and other states use a per capita rate. And we think that the rates that we've looked at that are fee for service are really low. So we have written comments supporting a per capita rate because we think that'll provide greater support for the community health workers. But we'll see what HFS settles on.
Agreed, yes. And this always comes back to Letitia's point of we need your voice and we need your advocacy around finding the best option, most innovative option for Illinois to include as many organizations and community health workers as we can.
Hey, it's Esther. You know, there is some federal money for diabetes prevention through Medicare. So I know that there are some hospital systems on this call. I'm happy to share with you, Angela, and you can, it is somewhat, it's not complicated, but the structure of it is, you know, very focused on the patient doing some core sessions to improve their diabetic health. And so it's sort of a tiered approach to the reimbursement. So I don't think we have enough time to go over it, but there is I have a very good document that kind of details the steps that one needs to take and what the reimbursement would be for participants in the program.
Okay, great. Yeah, let's send that out in the follow-up email as well. So that's That'll be helpful. Thank you, Esther.
Okay,
Okay, we have only a couple more minutes, so the final
I have
questions.
a couple of additional questions on reimbursement. People are still a little confused on what types of organizations are eligible for CHW funding and whether or not they can hire CHWs with a different title within their organization and still get reimbursed for their work.
Great question. Does anyone want to hop in on that?
I mean, I can speak very specifically to the Cook County Department of Public Health program that we hope to be, releasing this funding opportunity by the spring. In that case, you don't need to be any kind of specific organization. We'll be prioritizing communities who have, long suffered the worst health inequities in suburban Cook. So I don't know who the question is specifically coming from, but it'll need to be someone who is serving the communities in suburban Cook County rather than metropolitan Chicago. Or I guess Metro Chicago includes suburban, you know what I mean, outside of the city limits. In that case, though, it is funding, unfortunately, and this speaks to the bigger sustainability issue, this is grant funding, so it only will last for a couple of years. But part of our initiative is to work towards sustainability and figure out that reimbursement, like how to get reimbursement through health insurance or other ways too. So.
Okay, great. And it looks like Letitia, you wanted to maybe add in more about the legislative fund for the Medicaid reimbursement funding. Perhaps.
Well, the thing that I wanted to add was about the name, right? So up under the CHW umbrella, it's like 150 titles. And this is what compounds our problem when it comes to the title community health workers, because if you call them outreach workers, but it still falls up under the CHW umbrella, what's wrong with just calling them community health workers? So as much as possible that we can just keep the term community health workers, promotores de salud is the same thing, interchangeably, so to speak. No offense to anyone, but we would love for people to kind of stick with that title as we move forward with trying to, solidify funding and reimbursement and certification process for CHWs in Illinois. So a part of this process, we will definitely be including all of the 150 titles and things like that. But right now, it's just that is part of our challenge, right? Because even with the Bureau of Labor Statistics and working with IDES, when we tried to figure out a code, just the billing code, they have a community health worker code, but then, because a lot of people are not identified as community health workers, it makes it difficult to settle on a billing code. So we want to try to eliminate as much confusion as possible and try to keep to the name of the job as community health workers. And then in your process of, submitting funding to these different funders, just explaining what they will be doing under that role, right? No work of a licensed professional, but there is a definition that we've adopted through the American Public Health Association. And it has been included in both of the legislations that have passed in the state of Illinois. So we want to stick true to that definition. But I am available offline to talk more about this because, again, that is been our number one problem in really moving forward with elevating the workforce is all of the different names based on these funding sources. People just call them something else, and then eventually they still fall up under the community health worker umbrella. So if you can help us, that would be great.
Agreed. That is a tough issue. All right. Well, we are at 10:30, a little bit past now. So I just want to really thank everyone for sticking around with us. So many of you have stuck on the line. So we hope you've gotten a few of your questions answered. And will continue to network with us and or fill out the surveys, please. That would be fantastic. We want to keep this conversation going because we know we didn't reach even half the questions that we wanted to get to. So really appreciate your time. Thank you to our interpreter, Roberto. He's been wonderful. And just all of our panelists, our foundations that support this work, Community Memorial Foundation, Healthy Communities Foundation. And thank you. Yeah, we really appreciate your time and have a wonderful day.